lactation consultants, which are excellent, that you can always consult with.
Hmm.
If you run into trouble, I think, very early, usually in that first like week period, people tend
Yeah.
to, I found a lot of my patients just quit after that because
Wow.
yeah,
Yeah.
because it just was painful, or they feel like there's not
Hmm.
enough milk,
Hmm.
and that's also all of those things. It's quite possible that those things actually happen.
Right.
For me, this time around, like I said, my milk didn't come in for 3 days.
Hmm.
My baby was jaundiced for a couple, for usually the third day she was turning a little yellow, but then the milk came in,
Okay.
and her bilirubin level was fine. But there's always that risk of, is my baby getting enough? Right? Are
Yeah.
they getting enough
Hmm.
nutrition? It's also normal for infants to lose weight,
That's right. Yeah.
100%
Hmm.
of their weight in the first week of life. So, it's important, or I'm sorry, the first 2 weeks. So it's also important to know that your infant may lose a little bit of weight before they gain weight. And I think
Right.
for some moms that can be very scary if you don't know. If you don't know that, and you're like, well, if there's not enough milk,
Absolutely.
I'm going to give formula because my infant, is losing weight, or they don't seem
That
like
part.
they're hydrated.
Right.
So it's
Hmm.
always good to consult with someone to really
Hmm.
kind of help you with those
Hmm.
things, because I think there are definitely tricks of the trade to help with pain, to help with
Yes.
latch, to help with supply.
Yeah.
You just need somebody to tell you that. And if there's no one in your immediate family who can help with that, then you can certainly consult a lactation consultant. And also, many doulas are trained lactation consultants as well. So if
Yes.
you do have a labor doula or are working with a
Hmm.
postpartum doula,
Hmm.
they can also help you with breastfeeding. So those are also
Right.
good resources. But
So you are completely almost kind of stationary until you become like a breastfeeding acrobat.
hmm
In the beginning, you're gonna want everything you need within arm's reach,
hmm
to make sure that like once you sit down for your session or whatever, that you have, if you're going to read, if you're going to be on your phone, if you're going to be doing some work on your laptop or tablet or whatever, that is all within arm's reach, because you ain't going nowhere, especially if you're using the support of support of pillow or anything
hmm
else to
yeah,
support the baby.
get comfy.
You're gonna get comfy, and so don't just think, oh well, let me go ahead and feed the baby, and then the baby's in position, and when the baby's milk drunk and they get some rest, like you want to make sure you're comfortable enough to get some rest as the baby's resting too.
Hmm
After that good burp,
Yeah,
you want to get that burp
you want to
out.
have your birth cloth because you might get
Yes,
puked out.
absolutely.
That's one thing that
But yeah,
you
and
want all of your
another thing
clothes
is
covered
that
in
like
puke.
having,
I said, if you don't want
if
all of
you
your clothes
don't
covered
like,
in puke, you need a burp cloth. Don't forget that.
you absolutely do, but then also that's just a part of the thing. That's a part of the gig. You're gonna have puke on everything. I'm just saying. You're gonna think you're gonna be leaving the house looking so cute, and then it's gonna just be this little. I didn't even. How did that even get there? It's coming.
You know what's the best?
Um,
Puke in your hair. You're like, wait, hey, dang.
Absolutely unavoidable unless you have a perma ponytail, like right here. That's it. It's a wrap. It's a wrap. But also so the having your, I don't want to call it like your plan, but your support network for
Mhm.
your
Yes.
feeding process, right?
Mhm.
So um if you want other people feeding the baby,
Mhm.
as a working mom, my baby must eat while I'm at work.
Mhm.
So my mom is responsible for that. Having that person or that support network in the process as early as possible, because babies can sometimes become very creatures of habit. They're like, I
Mhm.
want my mom feeding me my milk, like
Mhm.
that's what I want. You do that and then think after maternity leave you're going to leave the baby and go on, the baby's going to be like, no, this ain't it. It's only 50%, this is the milk, but this is not my mom.
Mhm.
So you want to make sure that you're familiarizing the baby with the different types of feeding,
Mhm.
whether that, for
And
me it was my
if
mom.
they feed from a bottle, because some
and and
infants don't,
and that part too,
it
that
takes
part
some
too.
time to transition to the
Exactly.
bottle. Yeah.
Right. So start your transition if you're going to need help, or if more people are going to be participating in the process. So you're not stuck like my sister-in-law with her baby attached to her boob for 2 years.
Everywhere she goes.
Oh my gosh. So that is it's a transition period. It's not going to be like, oh, I'm going back to work tomorrow and y'all will be fine. Like, and then put in that pressure on the other person to feel like they're also now feeling because I can't get the baby to nurse.
Mhm.
Um, Making sure that you have like your smell and leaving your shirt with that
Mhm.
person. And I know that there are we're in the tail end of a pandemic, and some people are like forever working from home or and
Mhm.
have that. I'm so excited for so many people that they're now allowed to have that experience, because like America's like one of the last countries, or is the last country, to not really have a significantly lengthy enough stay at home for moms if they're going
Yeah.
to be working. So that a lot of people will be able to stay longer than 6 or 8 or 12 weeks at home with their baby to continue that process. And I'm very, very excited and happy for them
Mhm.
that they can do that. But also, as a bonding experience
Mhm.
for the other parent or the other caregivers of the baby, to involve them in that process as well. Like, I'm a full advocate of like trying to help the baby nurse from a bottle, so you can do that if you're still going to be using your milk too. So
Mhm.